Welcome to part 3 of a 3-part series on the 10 things you need to know about running injuries. I'm your host, John Wolf, and we'll continue the discussion that we started in parts 1 and 2. The 7th thing you need to know about running injuries is that it's always about the core, really. And I put it that way because oftentimes I hear people saying that core stability is, everybody's talking about it. It's almost like a trite statement. However, the truth is the core is essential in preparing the lower extremity for success. What the core muscles do is it ties the legs together at your body. And with good core control, it properly prepares the landing muscles for success. As I mentioned, you're constantly relying upon those muscles of your legs in order to provide the best shock absorption possible. When your core muscles are not engaged properly or they're not trained in order to prepare your muscles for landing, you're going to absorb more force transfers up into your joints and to the tendons and ligaments that cause pain. Well-trained core muscles are going to prepare these muscles of your hips and the muscles of your thighs and muscles of your ankles for absorbing this force through a multiplanar motion system so that you can distribute these forces rather than delivering them to the joints, which cause increase in pain and eventual injury. The 8th thing you need to know about running injuries is to get a plan. Truly, if you want to get somewhere and if you're semi-serious about running or staying fit because you're a jogger and you want to perhaps do something like enjoy a 10K or a 5K race in the community, you really should put a plan together. And to have an effective plan, you want to be clear on your goals. What do you want to accomplish? Is it that community run? Is it running with your friends? Is it getting on a simple jogging program? And what you have to do about a plan is balance your breakdown with recovery. And what I mean by that is that running is a process of breaking your body down. How you get strong and how you actually improve your ability to run is during the recovery cycle. So what you have to do is respect your regeneration cycle. And usually a solid plan means the right amount of breakdown, the right amount of training with the right amount of recovery. And for those who stick to their plan, they usually succeed with the least amount of injuries. I am a pretty big fan of using some sort of expert guidance. And those guidances, people who guide people in our community include specific coaches, because when you have a coach, oftentimes those people can use their expertise to guide you successfully. The 9th thing you want to know is about regeneration and how to effectively build it back up so that after you train your body and break it down with the forces that you're enduring during running is to build it back up so that it gets strong as a result of the exercise that you're doing. As I mentioned already, the gains that you make are made during the rest cycle, and motion facilitates healing. In other words, after you break down the muscles, the tendons, and the cartilage, active recovery or motion actually helps to improve the circulation, which helps these specific tissues regenerate. And this is called active recovery. We have some very specific things we teach people at the clinic in order to maximize their recovery cycle to minimize injuries. We also know that tissues adapt at different rates. For example, muscles recover pretty quickly. In about a 2 or 3 day span, most people recover in the muscles because there's a rich supply of blood and a rich vascular supply in order to bring the healing nutrients. Bones, however, take much longer to recover. So people who are recovering from bone injuries, we often have to dose them differently and get them active but at a different pace. Those with cartilage injuries and nerve injuries, we can help them understand that it takes much longer for those tissues to recover and heal. The last of the 10 things that you need to know about running and running injuries is that the rules are changing as you get older, and you should know these rules in order to minimize the chance of an injury. What we know about the body as it ages is that the total muscle mass decreases by nearly 50% for people between the ages of 20 and 90 years old. And on average, people lose about 30% of their strength between ages 50 and 70, and another 30% of what's left per decade after that. Generally, people lose about 1% of their lean muscle mass per year after age 40. So our advice to athletes and runners who plan on getting older is that they should take a very good inventory of what aging means to you, which means be realistic about your goals. And that doesn't mean that people need to simply quit and stop running or stop training, but rather just adjust your goals so that you can stay healthy, knowing that your body is not as capable as it used to be in its ability to absorb forces and to regenerate itself. Resistance training, we do know, helps to slow the process of muscle loss. So we do recommend this very highly in those older athletes who are training and running. We also recommend expert modifications to a training program for those who are serious about training and running. Aging is a natural process. We simply recommend that people understand that there are changes to the body and to embrace these changes as you get older and simply be smarter with regards to your approach to training. There are 10 things that we covered in this web presentation. The first was a quick instruction on what is the pain and why it is such a pain. We then covered gravity and talked about why it's a battle that you're not going to win, but rather how to better manage it. We talked about the ground and it's hard and ways that you can make it softer by some of the choices that you make in your training. We also talked about how running is a shocking experience and how you can better attenuate it. We also talked about getting off the brakes in order to decrease that braking impulse. We talked about the joints and how the joints are made of cartilage, and that if that cartilage wears down, then it's about a joint replacement at some point. We also talked about the core. It really is about the core. These core muscles help your body to succeed by allowing a better opportunity for your lower extremity muscles, your leg muscles, to be better shock absorbers. We then talked about getting a plan. Anytime you want to accomplish something, and if you want to do it smartly, get a plan. We talked about regeneration and how to build the system back up. And then we talked about the rules change as you get older. Knowing the rules is going to help you be healthier as you get older and stay active. So in summary, pain is information that means something. You should know what that means. And if you're not sure what it means, see a professional such as a physical therapist who can help you get the answers to what's causing the pain. Knowledge is good, but know how it applies to you. So don't spend too much time on the internet necessarily researching your injury. It just may create a lot of anxiety. Have a relationship with professionals you trust to guide you through your injury. Invest in your equipment and your body, and think of the return on that investment, and we always recommend that you be proactive. So your next steps, realize this information. Resolve your injury if you have an injury or if you have some pain. Get some expert guidance for proper management. And if you're interested, get with professionals to create a plan. And at Proactive Physical Therapy, we are constantly developing strength training programs for runners so that they can minimize injuries and stay healthy, so that they can continue being on the road as a healthy runner. Thank you for taking the time to watch this video. I hope that it was instructional, and if you have any questions, please contact us at www.proactivept.com.